Well, one of my favorite quotes, Christine, is that the best way to predict the future is to create it. And I think there is an element of that with entrepreneurship where you're telling a story and trying to almost bend the future, right, to your worldview. And yeah, it's a good way to get lucky because you end up, you're the one that kind of bent things that way. So I think that's probably right.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Our guest today is Dr. Graham Gardner, a visionary in healthcare innovation. He is the co-founder and CEO of Kyruus Health, leading the development of a platform that revolutionizes patient access and provider data management, now serving over 425,000 providers and 1,000 hospitals. Dr. Gardner's unique perspective is shaped by his background in cardiology and his entrepreneurial journey, which includes co-founding Generation Health, a genetic benefit management company that was acquired by CVS Caremark. His work with Kyruus has set new standards for patient-provider matching, significantly enhancing healthcare access and efficiency. In this episode, we discuss Dr. Gardner's transition from medicine to entrepreneurship and how Kyruus is transforming healthcare access and efficiency. We also explore his thought on the future of healthcare technology and the importance of data-driven decision-making. Here's our conversation. Welcome, Graham. Thanks for joining me today.
My pleasure. Thanks for having me.
It's been, we've been looking forward for this conversation. And so it's so great to finally have you here. I always like to start the question around how about your journey, how you get to where you are today. And I thought it was really interesting. You started your career as a medical doctor and then somehow decide to get into the business world. And what prompted you to do all that journey?
Yeah, no, that's right. So, Christine, I actually grew up in Europe for many years. My parents are both Scottish, so I grew up in Scotland and France for a number of years. But I came to the United States when I was 8. And one of our neighbors and good family friends was a pediatrician. And I looked up to him, and being like him meant being a doctor. So I declared, very early on, I was going to be a doctor when I grew up. But my father actually worked in the pharmaceutical industry. And so from a very early age, I knew that healthcare was broader than just seeing patients every day, that there was this, kind of larger ecosystem and a lot of other stakeholders that play into the health of folks. And I think I always suspected, Christine, all along that at some point I would wander out of clinical practice and, do something at the intersection of healthcare and technology. But I found medicine an incredibly compelling profession. The privilege of taking care of someone's life is really special. And there's also a terrific learning curve. I'm very much a learning curve junkie. I love, doing new things every year. And in medicine, they were always giving you, new responsibilities, new technologies and medical devices to play with. And so, for many years, I was very excited to do that. Fell in love with cardiology, which is very impactful. And it's one of the things it's very important to me that what I do every day makes a difference in the world. And in cardiology, every once in a while, you're really reaching into someone's life and trying to make a difference. So I did that. I pursued my clinical training up here in Boston. And then all of a sudden, Christine, the learning curve just stops. You end fellowship and they're like, okay, we're done training you. Now you have to go off and do this for the next 40 years. And I got very restless. And luckily for me, my father had just retired from Merck and actually became an entrepreneur very late in life. He actually helped to start a number of meaningful biotech companies. And so I learned at the age of 30 years old that there are these things called entrepreneurs and venture capitalists. People get paid to start new things. And that was incredibly exciting to me. And I think in retrospect, I fit very much the mold, right, of a first generation American, probably hardwired a certain way, right, to be an entrepreneur. So that became kind of this lightning bolt moment for me. I remember over the course of a few months speaking to anyone who would listen to me, trying to figure out what was business like, what were all the different possibilities. I actually chose to go to business school, quite frankly, to give myself some time to figure out, what was out there. And at business school, I had the incredibly good fortune of meeting one of the founders of Highland Capital, who was one of my professors. And so I joined Highland. I initially thought I would be a venture capitalist. It seemed like this incredibly exciting job. I'm sure I have a little bit of mild ADD, and it seemed like, you get to play across many different things. But I found myself yearning to be on the other side of the table. I wanted to go build things. And Highland was super good to me and said, hey, Graham, if that's the case, here's the pot of gold. Go off and start companies for us. And, what I had experienced already at Highland was it was just such a great platform to meet people, to see ideas and see trends that were developing and there, have the pot of gold, if you will, to go in and start things. So in my 2008, started my first company with them, a company called Generation Health. And we did something that I've adopted here at Kyruus Health as well, which is taking a business model that's worked in one area and leveraging that and having that, provide something of a roadmap in another. So I'm sure you're familiar with the pharmaceutical benefit management industry, which, a generation ago had come in and really helped organize pharmaceutical drugs. They created formularies and driven volume-based discounts, organized mail order pharmacies, and really driven a lot of efficiency and helped, match people to the right drugs and medications for them. 10 years ago, we were seeing a lot of trends around personalized medicine and genetic testing, but also a lot of confusion about when should a test be used to guide therapy or diagnose someone. And we wondered whether we could organize a genetic benefit management around that and really help people understand how to use these very expensive very expensive tests to guide the right kind of therapy. So we started that company. I had the privilege of jumping in and being chief medical officer, which was an incredibly exciting experience for me. I learned two things. One, I love being around product and imagining, what could be. The second thing was very surprising. I loved how to sell. I loved being in front of people, which I never would have guessed, right, as a physician. But I liked, being able to paint a vision of what the future could look like. So we ended up having an incredibly lucky ride there. We were acquired by CVS Caremark about 13 months after we started the company. But it was enough for me to really understand, the entrepreneurship thing was really important to me. So I hired my replacement. I came back into Highland and began to think about, what we might do next. And so this is now the 2010 or so timeframe, Christine, and there's some really interesting things going on in healthcare. First of all, Obama was, in the presidency, and Obamacare was going to signal that we really had to pay attention to healthcare data like never before. We weren't going to be just, building operating rooms and doing things to people. We were going to be accountable for the care. And so we really need to understand, measure care in a different way. And fortunately, the industry was getting digitized. So more and more data was becoming available. And tools like big data and Hadoop were, working their way from other industries into healthcare. And so you had this really magical constellation of, more data, the ability to process it, and a reason to process it and understand it like never before. So around the time, and I've told this story a few times, it's very much the inspiration for the company. I saw the movie Moneyball, which I don't know if you're familiar with from the sport of baseball, but I've been raised, Christine, by my parents with this worldview that we're all different. We are all beautiful in our own way. We all have our relative strengths and weaknesses. And what baseball had figured out was that there aren't inherently good or bad ball players. It's just people who are better in certain situations. And if you could use data and statistics to understand a relative competency amongst players, you could put them up to bat in a situation where they're more likely to do well. And the team could therefore be built playing to everyone's strengths. And I just found that a really affirming way to look at the world, right? There's a role for everyone, right? You just have to understand what their gifts are and then figure out how to leverage them. And it occurred to me that we physicians were a lot like baseball players. You might stink at doing hip operations. That's okay. Turns out you're really good at doing knees. Could we use this data to Moneyball for doctors, right? And figure out what people were doing and put them up to bat, which meant basically match them with the right kind of patients so that your top knee surgeon was doing knee surgery on patients that needed that. Hip surgeon was doing, their thing. So that really became the inspiration for the company and off we went down that road.
Well, you make it sound like, it's an impressive journey, but you make it sound like it's an easy journey. And not everybody can say that after 13 months, you got an exit. And I'm sure that there's a lot of bumps along the way.
There always are, Christine. And one of the things I tell to folks is that, it's always easier to weave a narrative when it's happened, right? And you can stitch it together. At the time, you're constantly wondering and, what's the right next step and, when these forks in the road come up. But, you trust and you follow things you believe in, I think, and inevitably you end up carving out a road that's meaningful to you.
And how, I guess, it's always, there's a sure thing in life is challenges, right? And the question is, how do you figure things out? How do you navigate so that more doors open for you? I think that takes some judgment and luck and assumption. And how do you bring that all together to that result in a good outcome?
Yeah, I would agree with you, Christine. I think one of the things I feel like I benefited from all my life was terrific mentors, whether it was teachers, coaches, my professional mentors later on. And, I mentioned as I was telling my story, I went out and talked to anyone who would listen to me, right? I've always sought input from other folks. I'm not a terrific reader, but I'm a very good listener. And so I really enjoy conversations. I find them very inspiring. So I think that's one tool I use to help do that. Then I think it's making a decision and committing. And that was something I learned in cardiology where, we often had very limited information, but you had to make a call. Does this person need to go to the cath lab at 2 a.m. because they might be having a heart attack? And you weren't always right, but you erred on the side of caution, right? And you made that decision and activated, a team. But then a huge part of it, Christine, is luck. I totally agree with you. I think you do the work to try to be in the right place, but you need the right time to hit you as well. And I don't know if any of us can predict that. You just, you hope for the best.
Although I have to say, I think sometimes, luck does play a role, but I think at the same time, your decision, your assumption, the decision who you team up with, the people who you work with there's some aspect of luck, but there's a lot of aspect that is not luck. I think is because it's a good work that people believe and trust you and then support you because of that.
Well, one of my favorite quotes, Christine, is that the best way to predict the future is to create it. And I think there is an element of that with entrepreneurship where you're telling a story and trying to almost bend the future, right, to your worldview. And yeah, it's a good way to get lucky because you end up, you're the one that kind of bent things that way. So I think that's probably right.
And how much, I think the more you talk to people, the better you are at your sales storytelling and your pitches. And I think, share us when you first started the Kyruus and when you come up with your idea and your vision, how polished was it when you started, or it kind of evolved as you go through it?
Not at all. In fact, I think one of the things that I look back on and I coach others to make a different choice was, I was too cautious early on. We had a vision for how to, transform how care was routed and we connected patients and providers. But it felt incredibly audacious to, walk into a hospital and say, hey, I'm going to take over this multi-billion-dollar organization of yours and do things right. And so we actually, there was a lot of things we could do with provider data, right? So we were at the time, mining things and buying claims data and trying to, compile almost this Bloomberg of all provider data. And there were a lot of different applications you could put on top of it. You could help an organization to recruit, providers better if they had, better access to a database. You could help them potentially credential faster. You could help them manage their industry engagements and make sure they weren't getting paid too much, by a medical device company. And then there was this, big audacious goal of, could you, coordinate care more effectively? And we actually started off doing some of the smaller ideas. And I, to be perfectly frank, I didn't have the courage to go for it right at the beginning. And we got a year or two in, and we were having some luck. We were beginning to engage with customers. We even had some folks paying us. But it became clear that we were trying to do too much and that we really had to focus and take a big swing. And I'll never forget the board meeting. I had just raised our Series B. And I told our new investors that I was basically going to shut off 2 of the lines of business that were making money and go for this big idea that was not making any money at the time. But I knew at that point was the only thing that mattered, right? If we're really going to do this, it was, this is hard stuff. And so if you're going to spend all these years gritting it out, do it for something that matters, right? And so we did. But it took me a while to get there, Christine. It was again not always a straight line up and to the right.
And how did you convince your investor? I mean, because looking investor, I'm sure they're happy to see that there's a lot of revenue coming in, and here you're trying to sell them a new dream.
Yeah. So that's very much part of it. It's the story, right? And can you describe something? I also was incredibly fortunate to have big thinking and long-term thinking investors as well. I remember one board meeting early on, and we were very proud that we had done $10,000 or $20,000 worth of bookings. And this investor, he shut the laptop and it's like, "Don't worry about money. Go build something that matters, and then we'll start talking about money in a couple of years." And he was absolutely right. It took me a little while to realize that, but I think that was the kernel that eventually got me to stand up in that board meeting and say, yes, some of these things can make a little bit of money, but if we really want to change how healthcare happens and ultimately benefit from that as shareholders, this is what we need to go do. But it took me a while to get there.
Yeah. And I'm sure you also have your investor trust you because of what you accomplished. That I think it's not just somebody like, who don't know what they're talking about and talking about something big. I'm sure that investor would not say that to them.
Well, it was not just me. We had some terrific team members also that probably inspired them to go along with it. So
maybe this is a good segue to tell us a little bit more about Kyruus, what it does, what it's trying to accomplish, what are the big problem that they're trying to solve. Yeah.
So, we recently rebranded as a care access platform. And the way I think about that, Christine, is that we're really a data and scheduling middleware that sits between all the different places where a person might go looking for care and all the different destinations where they might get that care. So, we had, and I'll share a little bit about how we grew the company over time, starting off initially on the provider side and then extending into the payers and ultimately other digital health companies. But what had become clear to me was that people were beginning their search for care in a number of different places. So they might go to their hospital and either call the call center or, get the name of a specialist from their primary care doctor or go to the website. So that was one place that people were looking for care. But oftentimes they were going to the health plan because one of the most important questions when you're looking for a new doctor is this person going to be in network and paid for if I go to see them? But they were starting also with search engines. They were starting with care navigation companies. And so too often the information, across those different settings was different, sometimes even in conflict. And the ability to transact, the ability to actually connect in and get care was very, very limited. At the same time, as you think about the places where people can get care, there are a lot of people that provide care. There are physicians and nurse practitioners. They were getting increasingly subspecialized. So, even when I first started practicing, Christine, folks had a sense of a go-to orthopod, right? Someone you got to know during residency. They were kind to you. You'd send them all of your orthopedic cases. They would send you a lovely holiday basket at the end of the year. Well, that has completely transformed, right? There's now a hand specialist, an elbow, a shoulder, a foot and ankle, a hip, a knee, a spine. And so how do you begin to understand all the different care options that might be right for someone? And then even beyond people, there might be a retail offering. You might be able to go to MinuteClinic to get your flu shot. You might have a virtual offering. You might need a lab or a radiology scan, without necessarily seeing a person. So there's just this increasing complexity of all the different places where someone might start, all the places they might go. And we began to see our role as really organizing all the data, all the intelligence, all the logic. And I think this is a really important distinction, creating the connection to actually allow that to happen. So what is it we do? We begin work, for example, with a provider organization. And we want to understand, who does what, where, when across that organization. So we need about 100 different data elements about each provider. Name, rank, serial number, pictures, the web bios, the locations, the insurances, anything that someone might want to filter and care about in a moment when they're seeking care. The challenge is that information sits in dozens of different silos across the organization, and it's all labeled differently. So, for example, my picture is in a marketing database labeled gardner.jpg. My specialty is in a credentialing file labeled Graham S. Gardner, MD. Now, my address also happens to be in that credentialing file, but you only re-credential every couple of years. So that's probably not the most accurate location. You probably want to take the location from my EMR where I'm seeing patients tomorrow morning, but that has an NPI number associated with it, right? So the technology basically is taking all of these pieces, saying this is the best source for it. That's all the same Graham Gardner. And let me now maintain that in real time. So you have access to this kind of real time, accurate, and governed database. We enrich that information. I think the most interesting aspect of which is about a 40,000 term library of every symptom, condition, procedure in every misspelling, abbreviation, or late term. And the reason that matters is that it allows you to meet patients where they are. So if I search for sugar blood, because that's what I call diabetes, that's okay. We know that's diabetes. We know to get you to a diabetologist, which is a sub-branch of endocrinology, without you necessarily having to know, fancy terms. You can type in AFib or AF or ASPACE-F or atrial fibrillation. You're not going to get 4 different lists of cardiologists based on which spelling you put in. It's all the same concept. You bring back the same folks. That's an important part of that precise clinical routing. Again, that money ball, if you will, right, of matching folks. So that's the data piece. And then we integrate real time into the underlying scheduling system. So we sit atop all the major EMRs like Epic, Cerner, Athena. And what that allows you now is to create experiences like we have on Travelocity or Kayak when we're searching for a plane, because now I can see all the seats across providers. So the same way I can look across American and JetBlue and Continental, I can look across doctors who are on Epic, Cerner, and Athena. I can sort and filter by what's important to you. I really want to see a female provider who speaks Spanish, takes Aetna, et cetera, and book a seat. And that early on solved a really, really important problem for health systems, because as they had gotten larger and as medicine had gotten super complicated, too often people didn't know where to go. So they were queuing up for Dr. Famous, right? Who everybody had trained with 20-year-old, go see, Dr. Jones. Not realizing there was a brand new doctor. She did exactly the same thing as Dr. Famous, but she was sitting empty because no one knew she existed, right? And so patients had these long wait times. They were leaking out of the network and going to other places because they couldn't get in. And yet, if you were running a health system, you're looking at this and saying 20 to 30% of my appointments are empty, right? So if I'm an $8 billion healthcare system with 20% open slots, I'm losing a lot of money that is otherwise queued up, waiting to get in. So we were able to help them solve, a really important problem where a patient was getting to the provider at the right time, providers practicing at the top of their license and doing exactly what they're trained to do, and you were getting, a return on assets, if you will. You're filling up all the providers and really operating at scale. So that was the business, Christine, for about 10 years. We went, mano a mano, hospital by hospital, building that up. I had, a lot of lessons and humblings from that time. But I think what we were able to do was, first of all, tell a compelling story. Again, like we're talking to, but then we also delivered for folks. And we actually, were able to instrument and show the impact that we were having. And we had some early customers, and this, I coach folks on this a lot as well, who became incredible advocates for us, right? One person in particular, I think, had overpromised something. We were able to help them come in and deliver. And for the next 3 years, I would get these lovely emails introducing me to a CEO of another health system saying, Kyruus is wonderful. They've helped us out. And, it's a great way to meet a customer, right? When one of their peers is advocating for you. So we've been fortunate. We're in about 1,000 hospitals and about 500 independent medical groups. So we're over 400,000 providers now that we are actively, kind of managing that data and scheduling. But, to our earlier conversation, we realized we were only, serving a subset of patients that were actually coming to the hospital. The health plans, if you still have gone to any, many of their websites, you see, a bunch of blue bobbleheads. There's 3 versions of Graham Gardner. You can't do anything like schedule. And so we said, hey, if patients are starting the search there, why don't we take all this rich information and scheduling workflow we're maintaining for our hospital clients and publish that, out at the health plan and ultimately out at search engines and care navigation companies. It's a wonderful way for them to acquire patients. And, as you know from the business side of medicine, new patients are very, very valuable to a healthcare system. So you want the right data and the right scheduling workflow to be all the places where someone might be looking for care. But it's also a huge help to the health plans and care navigation companies, because too often they were wrestling, trying to help a patient calling 6 physician offices, trying to figure out who's accepting new patients. They now have this wonderful, database that they can search for exactly the right condition and route people into the right care. So we realized we were solving, for both of those constituents. So that was driven through the acquisition of a company called HealthSpark that had been, operating on the health plan side. That was a wonderful experience, personally and professionally for me to acquire another company. And we did not get everything right. But I think what we did was cared deeply about mission and values, and found folks, like us that cared a great deal and wanted to do things correctly. And it was incredibly strategic, in terms of this ability to now stand up a two-sided marketplace. And then the last piece I'll talk to is, what that really uncovered was that there was, in fact, this broader marketplace. And it went beyond just health plan members. So we've got 90 million members now on our Care Access platform looking for care. So it went beyond that and the 400,000 providers we could schedule them with. It turns out they needed other kinds of services that we didn't have. So, as you well know, we are going through a behavioral and mental health crisis in this country, and we just did not have enough providers in our network to accommodate that demand. And so we went out to a lot of companies that have virtual offerings in that area and say, look, we have 90 million members. It's always one of our top 3 searches on the health plan. It's often number 1. Would you like us to put your inventory there? And, members can now find you. And instead of you being one of those blue bobbleheads that they didn't know that you're allowed to go see, you can now have these engaging videos, ratings and reviews, and a book now button that can, help patients. And again, you start to see how you're creating win-wins, for everybody. You're getting the patient, care in a timely manner in the right setting, and really allowing everybody in the broader ecosystem to play to their strengths. So I'll stop there, Christine, but I'm very excited about what we're building. So
yeah, no, it's really great. It's interesting way. I thought it was interesting that you started with the provider side and having that information that can be leveraged for the health plan side. And after having all that, you have all the members that can be leveraged for the behavioral health. It's almost like if you tell the story, almost like you planned it all along, but in a way, it's kind of interesting how that is kind of stepped out. Like the more you do, the more opportunity will come. It feels that's the way.
That's right. And again, I'm very good at telling the story after the fact. It was not always particularly strategic. But I think the one thing I'll say, and I've learned this language much later, Christine, but we started on the provider side because we wanted to really go to ground on the data and go to ground on the scheduling. We really wanted to be able to, hardwire into the EMRs. But I think what I've also learned in retrospect is that the hospitals were, in fact, their own atomic network. So they actually had patients coming to see them, and they had providers wanting to see them. So you didn't have to create a big marketplace and, balance, the number of riders and the number of drivers and get it all right one day. You actually were able to build out hospital by hospital, and now had a great supply to run a bigger marketplace around. So again, we're lucky in many ways.
Yeah. No, I think you also have the insight to unlock a lot of the opportunity that comes as you build your company, I think. One of the things that I want to ask you, like you're talking about, people always like to go like, which doctor you go, which famous doctor, who make the best? I got that question all the time because we are here at UCSF. The other day I was saying that a family friends is diagnosed with XYZ. Do you know the HEMOC? I said, like, of course, I know the best HEMOC oncologist in the world, and it's a good friend. So having that connection help somebody to identify who that person is. But I'm sure people still want to know, like, how does it come with the rating? Like, how do we know whoever that's in your list are somebody that we should go instead of the famous doctor?
Yeah, it's a really important question. So one of the principles we adopted from the beginning was that there is no such thing as a best doctor. We talk about the right doctor. And here's what I mean by that.
Your baseball moneyball.
Yeah. Well, that's me. But also as you think about how we engage with healthcare, it's often for very, very different things, right? So if I'm looking to establish a primary care relationship, that may very well be a 45-year relationship that I have with that person. I may care deeply that they have a shared identity. I might want someone who's a runner, right? Because I'm a runner. And if my leg hurts, I don't want them just to tell me, stop running, right? So I'm looking and prioritizing certain kinds of criteria. If I need my parathyroid, I'll give you a real example. I tore my Achilles tendon a couple of years ago. I was going to meet that person twice in my life, and one time was under anesthesia. All I cared about was that his hands didn't shake, right? In that moment, right? So I'm looking for different things in different settings, and that's how we see our role. Let's go collect those 100 different data elements so that someone can see, hey, these are the 5 that are important to me. They're there, and that's the right person for me for this condition, at this time. So that's an important principle. But beyond that, you're right. How do we think about outcomes data? And so we actually have a number of partners that we work with that try to balance, efficiency, quality metrics, performance, and stuff like that as part of the decision. Having practiced, I know all the nuances to that data. I'm not totally the person who's like, oh, my patients are sicker, but I understand that argument. I've seen that. And so I think you have to be careful about how you apply that. But in the right moments, those things can matter. And the hope is that, yes, ultimately you can drive folks to a higher quality person, not, again, because they're the best doctor. They might be terrific at knees, but you'd never want to send hips to them. There's another person. So again, across a network, hopefully there's always a right answer and everybody's always providing the right kind of care that they're able to provide.
And I think sometimes I think about, as I get older, thinking sometimes doctors, they can have the best credential. They know how to do knee, they know how to do hip. But I think somebody who can be very resourceful, and sometimes that's harder to judge until you meet that person, whether they will fight for your life rather than like, well, I've seen this, I'm just going to do it this way, instead of trying to find the best way for you. And how do you, and that's usually people go to friends to share, like, oh, I work with so-and-so, and then this is how the service I got. Maybe that make people feel more comfortable.
Yeah, no, it's a very important point. One of the ways we try to do that today is actually through the videos. And, you actually can learn a lot, even from a 30-second or minute video of a provider talking about their philosophy of care. Are they someone who, is aggressive and wants to intervene and get things done? And some patients really prioritize that versus someone who would like to do things naturally, as much as possible and only use medicine sparingly and things like that. So that's one way that we think about today. But where we're hoping to go, and again, this may very well be in partnership with others, is to begin to understand, who are you, Christy, and what's important to you. So I'm not just making a match on AFib, right, or Achilles surgery. I'm saying, hey, based on who you are, the kinds of people who resonate, that lead to better adherence and better outcomes, these are the kind of providers that other folks like you have found, to be the right match for them. And you're not always going to get that right, but I think that if I grew up in an era of practicing medicine where we talked about the term paternalism a lot, right, as a bad thing, and I very much embrace that. This is, I'm not of the world where you don't tell the patient they've got cancer, right, and only speak to the family member, stuff like that. But there was a role that providers played, right? They knew you, right? If your primary care had been with you for 30 years, they knew whether you were someone who wanted to jump to an intervention versus not, and they could provide some guidance. And there is a worry that in digital health, everything goes online, and you lose that person, that you're actually doing a disservice to the patient because you're saying, hey, Christine, I don't know, here's all the data, you decide, right? And how do we bring back this personalization of it? So we're thinking a lot about that. How do we get to know both sides of the equation so that we can ultimately make a better match?
Actually, hearing what you're saying, it make it feel more a customer service for healthcare, I feel, rather than just like, here, take this person and then you move on. And I think this is it's nice. I mean, I'm a Kaiser member, so it's so different on how the world lives. So oftentimes I don't see the challenges that is faced in non-Kaiser like environment. And I do want to ask a couple things before, because we are running out of time here. You mentioned about acquiring another company. How is that process? It's, this is great. You bring another basically a big team to come into your company, and oftentimes culture is always the challenge. And how do you ensure that merge acquisition goes seamlessly?
Yeah. So I, at a high level, I find acquisitions incredibly compelling, and I think, particularly in today's environment, they're very, very relevant because there has been an overfunding in digital health. There are too many companies that do too many of the same things. And when we talk with our clients, they want less vendors, who do more, not 100-point solutions. And so and we will play a part in this of bringing together other companies to stitch together and offer, much more seamless and turnkey experience for our customers. So there's a lot of product strategy that goes into understanding what those are. But what you're getting at, and I totally agree with you, one of the most important things is that cultural alignment and strategy. So, we did a couple things. And this happened in both cases. You go down and you actually to their offices and you see their core values on the wall, and you're like, oh, same core values, very similar, right? And so that's a really important part is seeing kind of that alignment, not only in the values, but just that they have values and that this is something that they care about and talk about. We look a lot for humility. It's something that we're very mindful of at Kyruus. This is an industry that will humble everyone over time, and I think you when you make mistakes, you either get very bitter about it or you accept it and you understand your role in it and you come out much, much better the other side. And so I actually look for that. I look for folks who quite frankly have been humbled, and I ask people about the mistakes they made. So that's always a part of those conversations. Then there's the deal and structuring that. Sometimes it's cash, sometimes it's earnouts and stock and things like that. And then the real hard work. So, if people think, okay, the deal's done, it's been announced, like no, now it's hard. So we actually have a team that basically lays out a 6-month roadmap, a bunch of different work streams. It's what you think are little things like just getting emails changed over so people aren't managing 2 different calendars, to how you're going to announce this to the market, how you're going to ultimately bring technology and stuff like together. We didn't get either one perfectly right, that's for sure. Hopefully we learned a lot in the first one, that we got better on the second, and we'll be better even on the third. But I continue to believe it's an exciting way to build companies, because you're able to take, folks that have been working on something for 10 years alongside you and marry these things together and realize it's magic. So we're very excited to keep doing that.
That must be a rewarding feeling when you see that happening. So last 2 questions. You mentioned learn from your mistake. What are the mistakes that you learned from, and what do you learn from it? And the other thing you mentioned earlier, that you try to learn something new every year. What is the thing that you're trying to learn something new this year? Oh,
very good. Very good. So I made a lot of mistakes. One of them that I made very young in Cub Scouts many years ago, but has really stuck with me and informed very much how I think about engaging with our team. I was the troop leader, and we were supposed to do some project of, using sticks or ropes to get across an imaginary river, one of those types of things. And I was handed the piece of paper that had all the instructions, and I read it and I tried to memorize it. And then I tried to direct people what to do. And inevitably I forgot and made mistakes, and we completely bungled it. And the Cub Scout leader came to an end. How wonderful, right? To get feedback. Came to me and said, look, you could have read the paper to everybody and allowed, transparency where everybody could have heard it, weighed in. You could have sourced ideas from folks and leveraged the team. And I've never forgotten that, Christine. And if you ever talk to I run a very transparent organization. I believe in wisdom of crowds. We talked about diversity long before it was the cool thing to do. I fundamentally believe that if you create an environment that is safe for diverse viewpoints to come in, you make better decisions. So that was something I've learned very, very early on. At Kyruus Health, I think the mistake I'm in some ways most ashamed of, because I've done it twice, is getting out ahead of ourselves and hiring and having to restructure the company and let people go. That for a founder is an incredibly emotional event. You convince folks to leave their jobs and bet their family and their professional careers on you. We are inherently optimistic, and so you believe you're going to grow at 1,000%, and you can get ahead of yourself. You can get over your ski tips, and I've done that twice, and it's incredibly painful. I've pledged never to do it again, and it's something I think about a lot. So we put in systems and conversations to make sure that that's not happening. We're fortunate now to be profitable, so it's less of an issue. But those are two that really stick in my mind.
Oh, thank you for sharing that. And what are you learning this year? What new thing that you're learning this year?
So, I'm almost embarrassed to admit, but I'm still trying to learn the health plan business better. It's interesting. It's all fun and games to talk about, acquisitions, but you don't realize how deeply rooted I was on the provider side of the business, right? I was a doctor for many. I have so many instincts and networks and knowledge of how the provider business worked. And I ran a provider business, for 10 years before we bought HealthSpark. And so, you understand it obviously at a superficial and a high level, but really getting in there and understanding how folks think, how they make decisions. I'll just give you an example. The health plan industry is very compliance driven. And so, even the provider directory, they had historically thought of less as a care navigation tool to get people, but more of like, well, I'm required to do this and it's got to have these elements to it. So, my sense is that the deeper I can get and understand the different parts of where we serve, the better we'll be able to make strategic decisions. So that's where I'm spending a little bit of my time.
Well, that sounds good. I'm looking forward to see what other things that you're doing with the company and the impact that you're making. And
thank you.
Thank you for sharing your story.
Absolutely. Happy to. Thanks for having me.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.